You know, one thing about Mississippi is we love to eat. And I mean, we're number one in the country for obesity and number two, type 2 diabetes. And there's a lot of people out there that say, I'd love to lose some weight, but I have a problem doing it. Well, today on the show, we're at Singing River Health System in Gulfport at their weight loss center talking to nurse practitioner Anna Kahlmus. How are you?
I'm good.
It's a pleasure to meet you. I'm
yes,
well.
So
I'm
nice
well.
to meet you.
Tell us a little bit about yourself first.
So I'm a nurse practitioner, and I've been doing this for about 5 or 6 years, but I've been in the field of weight loss specifically for 3 years. It's something that I'm really passionate about. I love doing this and working with patients who need some help with their weight, obesity.
Now, there's people out there that are trying to do it, but they need a little bit of extra help. I mean, sometimes dieting just does not work. I mean,
Exactly.
I hate to admit it, down here, Anna, we love to eat. In the South, we love to eat.
We do love to eat.
You give us a good family reunion, we're there.
So that actually brings up a good point. We have what I call a toxic food environment. Anytime you go to a gathering, you're surrounded by food. You drive down the street, there's a fast food restaurant on every corner. And it's hard sometimes to make those choices. And then also, it's important that we treat obesity like a disease, like we would anything else, like high blood pressure, cholesterol.
Right.
It's nobody's fault. They didn't do this to themselves. It could be a genetic thing. It could be medications that they're taking.
Right.
So
Tell us about the weight loss program here.
So we have a comprehensive program. We do bariatric surgery, and then we also have medical weight loss, which has really ramped up in the past year, I would say. We've got a program specifically for a medication called semaglutide or semaglutide. It's pronounced both ways, but our program is a 3-month program that comes with seeing a nurse practitioner or physician assistant and a dietitian, and it also comes with 3 months of medication.
How does it work? I mean, this is something new to me. And I've been doing this show for 19 years and heard of all kinds of different stuff. This is new to me. Tell me about this.
It's new to you and new to a lot of people, but the drug itself is actually not very new. It was first made several years ago for people with diabetes, and last year it was FDA approved for the treatment of weight loss.
Okay.
So the medication itself acts as a hormone called GLP-1 that we have occurring naturally in our body, and it's released in response to food. So it works in a few different ways. One, it signals your insulin, your pancreas to release insulin, and then it also slows down your gastric emptying, so you feel full faster. And then it also triggers some fullness hormones in your brain or satiation receptors, so you don't get as hungry. And so basically, increased fullness, decreased hunger leads to weight loss.
Who qualifies for this program?
Anyone above the age of 18 first, and then we also need to know their body mass index or BMI measurement.
Right.
So a BMI of 30 or above, or a BMI of 27 or greater with a condition like high blood pressure, high cholesterol, sleep apnea. And if you don't know your BMI, you can quickly go on to Google BMI calculator. All you need to know is your height and weight, and then you'll be able to find that number.
Now, how's the treatment administered?
So it's actually an injection. Some people get a little nervous when I tell them that they're going to have to inject themselves, but it's not bad.
Okay.
So it's a once-a-week injection. It comes in a pre-dosed pen, and the needle's very small.
Almost like an EpiPen.
Kind of like an EpiPen, yes. And I tell all my patients that are really nervous, after the first injection, they'll see that it's a piece of cake.
Really?
Yes, but
So,
as long as they don't eat the cake.
a little medical humor there. So what are the results?
It varies from person to person, but you can expect to lose up to 15 to 20% of your weight.
Really?
So if you weigh 200 pounds, you could potentially, lose 40 pounds. But it just depends on the dose that you are able to get to, how long you're on the medicine, and what, the effort that you put forth as well.
Can I get up on the table now? And I got this little pudge down here I'm trying to get rid of. What about side effects? I know that's one of the biggest issues people are wondering, especially with something like this. Are there any kind of particular side effects?
Yeah, so with any medication, there's going to be potential side effects. But with this drug in particular, Most common side effects are going to be gastrointestinal, so nausea, maybe some constipation or reflux. But the good thing is we start temporary. We start you at a low dose of medicine, and we increase it to help minimize those side effects.
Okay,
So,
all right. Now, if someone is interested in finding out about this program,
yes.
what do they need to do?
They need to visit our website, Singing River Weight Loss, and our number's there. They can call us and schedule an appointment.
Well, that seems fairly easy.
It's pretty easy, yeah.
And then, now, I guess it depends as far as what's the length of the treatment normally? I guess it depends on how much they want to lose, or...
Well, that's a great question. So our program specifically is for 3 months, but the drug was studied much longer than 3 months. So it's safe to continue the program if you don't get to your goal weight at 3 months. And depending on the weight of the patient, a lot of times they won't get to that goal in 3 months if they have 40 plus pounds to lose. So it's safe to continue.
That's what I was going to ask you. I mean, some people that are, you know, I hate to use the term morbidly obese, but I mean, is this something, or is that,
Yes.
is this something that could work on them, or is this something that people who just want to lose, like you said, 40 pounds, 50 pounds, something like that, instead of a couple of 100 pounds?
Right. Well, that's a great question, and this medicine is good for multiple different people, but a lot of my patients have morbid obesity, have been struggling with their weight their whole life. Some patients have just gained weight, say menopausal weight. Some people with the pandemic, so the past 2 years, may have had a job change.
The COVID-19.
The COVID-19, some physical activity decline, and they've gained weight for that reason. So, but we will have a discussion with them at their first visit. Sometimes bariatric surgery might be a better option for some people.
I was going to say, I mean, I guess the point where you might have to get that gastric sleeve or something, or bariatric surgery to where, to really cut back on your eating. And then,
Yes.
So if, you know, those of you, as she said, that want to lose just maybe 20, 30, 40 pounds, that just have that little bit that they have a hard time getting rid of.
Right.
The semaglutide,
Yes.
is how you pronounce it?
So semaglutide, it's kind of like tomato, but we say it both ways. The trade name of the drug that's more popular is Ozempic and Wegovy.
Okay, I think I like semaglutide better. It's more catchy.
Yes.
Anyway, thank you so much
Yes.
for all this information.
You're very welcome.
This is
Thank
great
you.
new
Yes.
information for you if you're wanting to lose just that little bit of extra weight. What you need to do is, as she said, you can go to Singing River Hospital or Singing River
Weight Loss.
WeightLoss.com. The website is on or just call and make an appointment if you'd like to. Get yourself a little, weight help there with this new process with Singing River Health.